This is QD Video. I'm Jack Cush. QD Video is brought to you by RheumNow.Live. More at the end about that. Today's case is about a 70-year-old with rheumatoid arthritis and thrombocytopenia. Kind of a difficult case, I must say. This is a long-standing patient of mine who's been treated for many years for rheumatoid arthritis. In fact, she's been on gold, methotrexate, sulfasalazine, Plaquenil, obviously prednisone in low doses. She's tried TNF inhibitors, IL-6 inhibitors, and more recently has been taking methotrexate, and then it was switched to Areva. Her story is one that she was fairly well controlled on methotrexate, and then was later switched, or actually had Areva added to methotrexate. Somewhere in and around there, which is around late 2016, she started dropping her platelet count. Her other blood counts, white blood cell counts, red blood cell series were all normal, but her platelets dropped from 200, 250 down to around 100. And with the idea that maybe it was methotrexate dropping this, methotrexate was stopped, although she continued to drop from 100 to 90 to 70 to 63 and more recently to 50 while taking leflunomide, tramadol, atorvastatin, acetaminophen, metformin, and lisinopril. So really not taking very much to be implicated as a cause. So she's been followed by and evaluated by the hematologist who called this chronic ITP because it's been going on now for over a year and almost two years, really hovering around, again, 60, 70, 80, and more, but again, recently now it's 50. And they've called chronic ITP, said it's not worth doing a bone marrow biopsy. But because she dropped, now there was a concern a bone marrow biopsy was done. The question is, what is this and how to manage it? Well, it turns out that, number one, I don't think this is going to be methotrexate. It's not possible when you look at the chronology and when methotrexate was stopped and whatnot. And we do know that methotrexate can cause a pancytopenia, but methotrexate, when it's going to affect the marrow, it's going to affect the white blood cell series. It's notorious for leukopenia, and leukopenia, and then if you're really unlucky, you'll get pancytopenia. It does in an isolated fashion knock out platelets or knock out the red cell series and not affect the white cells. It's always the white cells, and then if you're unlucky, you get the other ones. And that's usually in the context of renal failure, and you know the scenario there. So the next question is this Felty syndrome? Splenomegaly, leukopenia, recurrent infections, and chronic long-standing severe seropositive RA. She's seropositive, long-standing, not too bad, no deformities really, not much in the way of erosions because she's been treated by a great rheumatologist. But you know, she doesn't fit the bill for Felties because she has no enlarged spleen. That was checked by ultrasound and by exam. So the question is whether or not she has a marrow disease like myelodysplasia or something along this line, some sort of infiltrative disease, and we'll find that out on the biopsy. But I'll tell you, I think this is due to Areva or leflunomide. She'll be the second patient I've had where this has occurred, where the consideration was either a marrow disorder like myelofibrosis or Felty syndrome, and there was no resolution when those were either addressed, treated, or considered. But when you stopped the leflunomide, boom, the platelet counts resurged up to a normal limit. So we just recently stopped her platelet count. I'm going to expect to see her platelet count rise. And if I'm wrong about that, I'll correct myself in future videos. But that's the approach, my approach to someone with thrombocytopenia and rheumatoid arthritis. Right now her RA is well, but we did stop the Areva 3 weeks ago, and put her back on methotrexate today, because I don't want her flaring, because she's really a wreck as far as worry about this. I don't want her to be a wreck with inflammatory synovitis coming back and taking over, because she's prone to do this. Anyway, tune in tomorrow for more cool cases from the clinic.